And now we are at our case presentation, which is always one of the highlights of our programs. And tonight, we're really happy to have John Fitzpatrick here, the co-founder and the CEO of Applivate, who is working on his app, ShugaTrack, which is an awesome app for people with diabetes to help them manage their condition. And it's some pretty exciting technology. So we're going to ask John to come up, give his presentation, and when he's done, we're going to invite our panel of experts to come up. Just so you know, the panelists have been provided with some information about what John is doing and his app in advance, so they could put some thought into the comments they want to make and the questions they want to ask tonight to try and help John out. So after he is done, I will call them up, introduce them, and they will be able to ask John questions and give him some feedback. So without any further ado, John.
Okay, thank you for the invitation to speak tonight. If you guys in the back row can't hear, stand up and yell louder, wave your arms, just let me know. So our topic tonight is choosing your target market, and to tell you how we chose our target market, I have to tell you something of the story of our company, and to tell you the story of our company, I have to tell you a bit of my own story. This is my first business venture. My background is in scientific research and in university administration. So to start out, in college I was a psychology major. I got to senior year, I decided I didn't want to be a psychologist, and I started taking some engineering courses. I went on to get a master's in biomedical engineering, and as I was doing that, I got interested in neuroscience, and I pursued that in a PhD in biology, focusing on neuroscience, and then I did postdocs at Brandeis and at Yale. And I left the lab in 2007. My point is that my background is in scientific research, and then I went on to a couple of administrative jobs at Yale. Now, as I was working these jobs, I kind of realized that for somebody with some entrepreneurial instincts, the bureaucracy of a 300-year-old academic institution probably wasn't the best fit. And I started thinking about what else might be a better fit for me. And I started thinking about starting a company. And it seemed like something I might be able to do because there were some friends in New Haven, that's where we are, who had started a company called C-Click-Fix, and they were doing well, and they were making an impact, and they seemed like mere mortals and not superheroes, and I thought maybe if they can do it, I can do it too. And so what kind of company am I going to start? Well, I have this biology background. I should probably make use of that, and my wife has type 1 diabetes, and I'm watching her manage her diabetes, and she uses a blood glucose meter and collects blood glucose measurements all the time, and she's using an insulin pump and is collecting data on that all the time. And it seemed like it would be a good idea to get that data into the cloud and do something with it. So I heard about a business idea competition called Startup Weekend. Be familiar with Startup Weekend? They're held in cities across the country, and I went and I pitched this idea, which is let's get diabetes data into the cloud and do something with it. I met my co-founder, and we won the competition and went on to found Applivate with the general idea, like I mentioned, let's get diabetes data into the cloud and do something with it. Now we've polished that up a little bit to the mission statement you see on the screen, transforming diabetes management through effortless data capture and cloud-based analytics. We went out and started talking with the diabetes community to get a specific idea, adhering to the lean startup philosophy, starting and defining a minimum viable product. And as we talked to them, we learned that the parents of kids with diabetes have a really hard job. It is a lot of work caring for a kid with type 1 diabetes and keeping them healthy. So we thought we would focus on them. So we chose the parents of kids with type 1 diabetes as our initial target market. And so how big is this market? Well, a little background about diabetes first to understand why this is difficult. So people with diabetes cannot control their blood sugar. People with type 1 diabetes cannot control their blood sugar because they have lost the ability to produce insulin. So they have to give themselves their own insulin. But this isn't very easy because blood glucose metabolism is very complicated and it's difficult to get the insulin dose right. And if you get it wrong, the consequences can be rather dire. If you give yourself too much, your blood sugar will go too low and a lot of bad things can happen and you can die. If you give yourself too little, your blood sugar can go too high and you can also die. Now, imagine you're the parent of a kid with diabetes and you're worrying about this all the time, because if you make a mistake like this, it's not like you die in a week or a day, you die in a few hours. And that's something parents have to face all the time as they send their kids off to school and over to friends' houses to play or to a sports practice or to a sleepover. This is something that is on a parent's mind 24 hours a day. So we picked this for our target market, and to look at the size of the market. Now, the overall diabetes market has 29 million people in it. The type 1 diabetes market has 2 to 3 million people in it. There are about 208,000 people under the age of 20 in the United States with diabetes. So we're focusing on, to start out, a segment of this larger diabetes market. And the idea is we focus on this particular group with a particular problem to establish ourselves and then expand into this much larger market. So what exactly is the problem we're trying to solve? Well, the problem is the stress, the concern, the anxiety, the worry of the parents of kids with diabetes when they're apart from them. Our solution is straightforward. Our product is called ShugaTrack, and the solution is that when a child checks blood sugar, or anybody for that matter, but we're focusing on children, when the child checks blood sugar, our ShugaTrack sends the result to the parent in a text message. The parent receives a text message. They know, first of all, that the child has checked like they're supposed to, and if the result is in the normal blood glucose range, they know that the child is okay, they can relax, they have a little peace of mind. If it's out of range, they have the opportunity to intervene. And this is how we address their stress, their worry. How does this work? Well, we have a mobile app, as you can see there, and we also produce a piece of hardware, which is that small black box. That is a Bluetooth adapter for blood glucose meters. It plugs into a data port on the meter. You plug it in its setup and leave it plugged in. The meter and the adapter fit in a small pouch like this. The adapter goes everywhere the meter goes. When the child checks blood sugar, they push a button on the adapter. The phone makes a Bluetooth connection to the adapter, talks to the meter, retrieves the blood glucose reading, the date and the time, sends it up to our system in the cloud. The information is stored, and then it is transmitted out to the parents in a text message or an email. We do emails too. It's very easy to use, as I said, a simple button push. And what's important to emphasize is that the user does not have to touch the phone. The phone can stay in their pocket, in the child's backpack. You do not have to bring up the phone, wake it up, look at the app, tap a button. All you have to do is your regular blood sugar check, push the button on the adapter, zip up your little pouch, and then move on. So this is our focus market. The initial target market is the parents of kids with diabetes. We have two features. One is the notifications, and the second is the blood glucose log, as all of the readings are stored online. We are focused on the notifications because this is what addresses this problem of the parents with diabetes. We don't talk much about the blood glucose log because it's not that flashy. So you get your numbers up into the cloud on the line. You can look at them on the web. But what really gets the parents' attention is this ability to, in real time, know what their kid's blood sugar is. And as we market at diabetes events, I can do a demonstration in which I check my blood sugar, draw a little blood right in front of them, get a result, show it to them on the meter, and 10 seconds later, it shows up in a text message on their very own phone. And they get this right away, how this can help them. And they can just imagine immediately. It's a very small step to imagine this happening when their child is at school or over a friend's. We don't talk much about the blood glucose log, but we're starting to get more interest in that. This accurate, up-to-the-minute blood glucose log can be of use in other markets to other possible customers, such as academic researchers who are studying diabetes and studying blood sugar checking, such as clinicians who are trying to monitor their patients in between their office visits, and pharmaceutical companies who are doing trials of new diabetes drugs. So as we expand and think about these and start to explore these other opportunities and work with these other partners, we will be also thinking about how we maintain our direct-to-consumer market. I mean, do we stick with that and expand out to them, or do we continue, or do we completely pivot over to this more of a B2B angle? So that is how we chose our initial market. The parents of kids with diabetes, focusing on a specific problem for a specific customer, and now we are considering other avenues and other applications of our technology. Thank you.
So I'm going to invite the panelists to come on up, and while they're making their way up here to the panelists table, Steve, you already know, our keynote is going to be one of our panelists. We also have Sherry Worthington. Hello, Sherry. I will let you read Sherry's bio, but she has a very long and distinguished resume of working with entrepreneurs in marketing and strategy. And we also have Deb Buckley, a serial entrepreneur. We love serial entrepreneurs who has tons of personal practical experience. I'll let you read her bio as well. I won't make you sit through me reading to you. Let me just. Oh, excellent. So if you could just make sure that you pull those up close.
I'm so loud anyway, I don't really think I need to pull it up close.
So as I mentioned before, the panelists have reviewed some of John's material and some additional material he's provided to them. They've given some thought to where he is with ShugaTrack, and the format here is the panelists will ask questions and give feedback and give their comments to John. He will answer their questions. When the panel is done, then we are going to give the audience members an opportunity to ask their own questions. So hopefully I will have no involvement for the next few minutes, and I guess I will just randomly ask you to maybe kick it off with either your comments or your first question. And I'm going to give you back the mic.
All right. Okay. John, thank you for the great presentation. Can everybody hear me okay? I can be loud, so there you go. Okay, a couple things. Can you talk a little bit about your distribution model, what your intentions are for distribution?
Right, so people sign up for ShugaTrack on our website. Yeah, that's how
So
we're
you're selling
distributing.
direct?
Yes.
Direct
Okay.
sales.
Yes.
Okay.
I have a question. Can you explain a little further about your intellectual property? You had talked about this Bluetooth piece. It wasn't clear if you're reselling that or making that, and then you have the app. And it kind of goes to your question about raising money, which you had asked of us earlier. Mm-hmm. Expand on the intellectual property. What's the super special sauce you have?
Right, so we sell both the piece of hardware, and that's the Bluetooth adapter for the blood glucose meter, and we have an app that works in concert with that, and we have a service based in the cloud that logs the blood glucose readings and sends out the text messages and the email notifications. We have applied for a patent, a non-provisional. Back in April, we filed a non-provisional application for a patent, and so we are working to protect our IP on all of it.
So you actually developed the Bluetooth adapter yourselves?
We did. The Bluetooth
Okay.
adapter is our design, and we manufacture it.
Okay. Why did you make that yourself versus adapting something that's already out there?
Right. Well, we initially did go to market with a Bluetooth adapter produced by another company.
That's what I thought.
We did.
Okay.
And that allowed us to get to market faster. That adapter was incompatible with iPhone, and this market is heavily iPhone. and it became clear very quickly that we needed to have an iPhone solution, and that's why we developed and began manufacturing our own adapter. It's also great to have all the technology under our control, right?
So does this work, the application, on all smart devices?
We have an Android version of the application and an iPhone version of the application.
Okay.
So John, how does this work with the kid has to carry around an iPhone or a smartphone?
The child needs a phone that they can install the app on. We have had parents provide children as young as 4 years old with phones in order to use this. The child obviously isn't using the phone for anything other than ShugaTrack.
Yeah. So the kid has to carry the phone, this adapter, and then the monitor or the meter thing, correct? What triggers the kid to check his blood glucose in the first place?
Well, it depends on the age of the child, right? If the child is 4, then a daycare provider or a school nurse is making sure that it's being checked regularly. As kids grow older, they begin to become independent with this and take on responsibility themselves. The standard blood sugar checking routine is right after you wake up, before you go to bed, and before and after each meal. That's 8 times a day. But people will test more often if they're snacking, if they feel off. You can feel it when your blood sugar is too high or too low, and they'll check. And these devices aren't perfect, so if somebody gets a reading they question, they'll check again. Yeah.
So do you have a relationship with the blood glucose meter manufacturer?
We do in the sense that they provide us with their communication protocols so that we can interpret the zeros and ones coming out of the meter.
So, I'm sorry if I'm monopolizing here. What would prevent them from doing your Bluetooth adapter?
Right. So our selling point is that we are compatible. Our goal is to become compatible with all meters. We have initially we are at this stage compatible with 5, and they can produce Bluetooth adapters. What's more likely and what is happening is that they're producing meters that have Bluetooth built into them. And we'll see how that goes. Those are new to the market, and they're not necessarily a threat to us because our Bluetooth app could work with their devices as well, provided either they provide the communication protocol or we're able to reverse engineer it. I don't view that as a threat to their business model because they're not making money off their app. They make money off the disposable test strips used with the blood glucose meters. And one in particular said that, of course you can have our communication protocol. We want as many people developing for this meter as possible.
I don't mean to be mean, but that seems pretty naive. It's not uncommon for a technology product to be disrupted by kind of the platform they're working towards. How many people have been put out of business by Apple and Microsoft and places like that? And so OneTouch already has an app that does what you do with just, click a button on their app and it will send the message. Now, it only works with their device, but from a customer perspective, I'm only going to buy one device. So this may be an argument for not selling to the consumer market, but going after someone who appreciates the fact that you work with multiple devices. Because the consumer is just going to have one device, and if OneTouch has made an app, then it's probably not unlikely that the rest of them are going to develop an app with the messaging capability as well.
I'm trying to figure out what to address there. So there are Bluetooth meters on the market. They do work with the manufacturer's apps, and we are willing to compete with those apps, right? And we can connect to those meters.
But you're competing with the meter manufacturer now, not just the Bluetooth adapters. So isn't that a bigger concern? OneTouch has a combo package that does what you do. It's not unlikely that the other meter manufacturers are going to do the same thing.
It is certainly a concern, and this is a fast-moving market.
So how are you going to, so what's your backup plan for that? Is that then why you're looking at the non-consumer market? What I'm saying is maybe that's why you shouldn't go to the consumer, because go to somebody who appreciates the fact that you're cross-platform.
Right. Well, the consumers appreciate that because they don't often they do not have a choice of meters. Often the meter is dictated by the insurance company. Also, they are often reluctant to switch. They become comfortable with these meters, and it's a trusted ally in a fight against a deadly disease, and they want to stick with what they have.
So even more of an argument for, there's already one app out there by a meter manufacturer. The other ones will probably follow quickly. How are you going to position against those?
Well, it remains to be seen whether this Bluetooth meter actually succeeds.
Okay, I think Sherry brings up some interesting points, and there's a company I'm going to tell you about that if you'd be so kind to do research, I think you'd find it really helpful for you. Is there anybody here from Provia Labs or Save a Tooth? No? That's good. Okay. So,
Are you going to pan them?
no. So Provia Labs is actually a company that basically, is a separate entity that did a company that spun off called Save a Tooth. And their target audience is parents, and their job is to extract teeth from children and then save it for stem cell. So they work with high-risk children, okay, maybe diabetes, maybe a cancer, a serious long-term illness, and they're trying to break into this market. They're in Lexington, Mass., so they may be a good person for you to talk to get some background. Coming from a consumer perspective, they're kind of struggling. They're, to break through, and it's expensive, right, to go directly to a consumer market. So they're partnering with dentists. So I just wanted to bring that to your attention and say that. Number two, I want to say ShugaTrack is a great name. It's a great brand. I love your logo, and I think there's a lot you can do with it. My headset is, there's a, what's your market? Do you choose your market, or do you let your market choose you? And I think many of us here on the panel today have built products or gone to market and tried to force a market into a product. So being a scientific gentleman and researcher, I really would recommend that you also dig into what's the noise on the internet, and you may want to start like at LinkedIn and see what kind of business groups exist that you can tap into, okay? And Google Plus to see what noise is there, because it's easier to go where your target audience is, where there's a market demand than to create a demand. The other thing Sherry brought up is a good point, is that the market is filled and there's a lot of competition. So going back to Stephen's comment about an enabler, is how are you going to differentiate yourself? And if you're going after the child-parent market and you decide that's where you want to go, I was excited to hear that you studied psychology, because marketing is about psychology. You need to understand and do the research on personas for each of those groups. So if you're selling to children from 2 to 5 or 10, and then the tweens, and then the teens, and then the college students, you need to break that out into those different groups. I'm sorry, I'm looking at him, I look at you guys too. And then understand various characteristics about it and attack that market based on their persona. Okay, where marketing is going, and because of the internet, is behavioral marketing. So you need to understand that psyche and get into that level, okay? The other thing I'm going to say too, if the teen market is something that's important to you, is how can you take your product and differentiate it and maybe use this as a gamification type concept. Instead of approaching it that you're sick, approach it for wellness, and how can you get preventative type organizations like insurance companies, Joslin Clinic, which is in Boston, the #1 diabetes, you must know that, to back you and support you. So that's just some of the things, and we can elaborate more, but I don't want to hog the whole time. Just ideas.
Do you want to respond first?
Do you want any questions? I know I throw a lot at you.
We're just throwing everything at you.
Boom, boom, boom.
Have you thought about the gamification aspect?
Very much so, very much so. So the first step
That
is,
would make you stand out.
It would really make you stand out. And you'd get community, especially the kids, right? How many of you guys have a Fitbit? Do you have a Fitbit? All right, so we got to connect. If anybody has a Fitbit, this tells you how many steps you take in the day, and it's built on community, and it's like having a personal trainer on your wrist, right?
Yeah,
got me?
we are thinking in all of these directions.
Oh, good.
Gamification. So when kids hit their teenage years, they don't want to do anything their parents tell them, and they also don't want to seem any different from their peers, right? So they don't want to be the ones slowing down the crowd because they have to check blood sugar, so they're probably not going to check it. And if their parents tell them to check blood sugar, that's probably another reason not to. So what we want to do is we want to build a motivation system, an incentive system, a reward system that will help them develop good diabetes management habits, good blood sugar checking habits, as they become independent and take over the management of this disease from their parents. And the first step to that is getting the numbers and knowing when they check. And that's the technology we've been putting in place.
And you could actually partner with, it would be easy to find the game aspect to add to the app, just with all the local colleges. Clark has groups working on that, WPI has groups working on it, so gaming is big at most of the schools around here. Get some cheap student labor to help you out, right?
Sure.
To keep the overhead low.
Sure. And the aspect of community is something we're also thinking about. So when there are diabetes communities online, and there is a lot of interaction in Facebook groups, right? And a lot of mutual support.
For kids?
Mostly for it's the mothers, right? And I say parents, but by and large, it happens to be the mothers who are shouldering this burden. And a mom will be up in the middle of the night because her kid's blood sugar is low, and no matter how much sugar and orange juice and cake frosting she pours into that kid, she can't get the blood sugar up, and she's not going to sleep because her kid might not wake up if she does. And they will get online in between blood sugar checks and tell people what they're going through, and the other moms will just rally, So there is a lot of potential for a community here, and I think we can take the communities that have built on Facebook and take them one step further, move them one step further, because when we have people's numbers, we can link people who are having similar challenges. My kid's blood sugar goes low in the morning, and she uses a Medtronic pump, right? And we connect people in her region who have that same blood sugar pattern, who use the same insulin pump, and that's valuable to them.
There's good proven points around that. I think it was AstraZeneca introduced a weight loss drug, I don't know, a decade ago, but they knew going into it that the weight loss drug alone wouldn't succeed without building the community around it, because that's really the way people lose weight.
Yeah.
So there's a lot to be said for that.
Yeah, and you spoke about differentiators, and what we're really focused on more so than anybody here is making it very easy and as close to effortless as possible to get your blood sugar readings into the cloud so that we can do something with them. And we've got it down to that single button push. You don't have to touch your phone, you don't have to look at our app. You just need what's in here. You do your regular thing, that one button push, you're back to your day, and we get the number. That's our focus.
So John, assume that you're successful doing this. You're going to have kids who you're tracking for a long period of time. You're going to find a lot of information that you're collecting over a long period of time. To whom would this be valuable, and how would they make money knowing what you're going to collect, and what would that be worth for them to know? How much could you make off of them selling advertising so that pharmaceutical companies can market something different to kids as they get older and know that they're trending a certain direction or something?
Yes.
So the dark side, not the community. not the games and community, but how do you
I
sell
was thinking
this?
insurance companies would love that data.
Yeah. Well, there's two avenues you can do. You can take the individual's data, right? And if you see that a single person tends to be trending high, then that's an opportunity for an intervention. If children can be hospitalized, anybody with diabetes can be hospitalized if their blood sugar goes too high and they develop what's known as diabetic ketoacidosis. And these hospitalizations cost $18,000 to $20,000. So if a care provider or an insurance company can keep an eye on those numbers as they come in real time, and see if somebody's trending higher and maybe becomes at risk of a hospitalization, they can intervene through a phone call, through an unplanned office visit.
Mm-hmm.
Right?
Interesting.
And that can, obviously that goes straight
And
to
so
the...
do you think, would they pay you for this?
They'd probably pay me less than $20,000 per hospitalization, yeah.
But perhaps a parent pays, right? Since the stuff is in the cloud, is you do a subscription-based membership model.
Right,
For
right.
X amount of dollars per month, we monitor your child. If there's something as a spike, boom, there's not just notification one way, but
Exactly.
either back to the child to say, whoa, I need some orange juice, and
Yeah, and that is our current model. I didn't mention that. It is subscription-based. We sell the Bluetooth adapter for $49.95. We're not trying to make money off that. We want to keep that as low a barrier as possible, and focus on making our profits off the subscription revenue. The subscription right now is $9.95 a month or $99.95 a year. And what we're doing with the notifications is providing something of value to the parents on that very first reading, right? So we get them on there, and they're getting something of value right away. And then build out the system, build out the feature set so that we can make use of that blood sugar history and provide more insights as the data accumulates.
You said you were looking to raise money. Roughly how much are you looking for? Angel level?
Right.
VC level?
Right. I would say angel level. Yeah.
Okay.
We have raised money to date through friends and family and through a number of programs run by the state of Connecticut. And it is, we are running lean in that regard. And it's difficult. When we speak to investors, they say, come back to us when you have more traction.
Yeah.
We like it. But we're caught in that circle where you need money to get traction and you need traction to get money.
Well, given the the emotions that are wrapped up in this, right? It's your child. Have you tried or thought about crowdsourcing to get you over that first hurdle so the angels will then say, now you've got more?
Yeah. There are a lot of, crowdsourcing is an option, and we're trying to figure out how best to approach that. So,
And there are at least, Amy Whitney, she's not here anymore, she did a research project, there's at least 600 different crowdsourcing portals, and there's one for every little niche you can think of.
Well, but before you crowdsource it, what are you going to use this money for?
we're going to use the money for product development and for marketing.
So how are you going to make money at the end of the day? You've got a 208,000 population total
Right.
addressable market.
Right.
Which is small.
If you captured all of them at $100 a year, that's $20 million.
Right.
It's not a lot.
Right. So that is our initial target market,
Yep.
and we're targeting that because the need is greatest. But if you look at those 2.2 to 3 million total people with type 1 diabetes, such as my wife, and I get her blood sugar readings on my phone, and I got one as I was driving up from New Haven tonight. She's alone with our 2 kids, so if there had been a problem, I could have pulled off and given her a call and made sure she was okay. So spouses are interested in this too. It seems that every other time, I tell somebody that we're targeting the parents of kids with diabetes, somebody says, my mom has diabetes, I would love this. Right, 25% of the people over 65 have diabetes. So this also helps the adult parents of people, adult children of people with diabetes.
How does that break down in the 2 to 3 million if you look at the?
Those are mostly type 2. The
Oh,
older
all right.
people are mostly type 2.
Type 2.
2 to 3 million is
Do you have
type
a
1.
product that would help that, or is that a possible next step?
This applies to type 2 in the same sense that it applies to type 1. The acute risks aren't quite as acute with type 2, so the need isn't that great. But the people still want to keep an eye on people with type 2.
Which is interesting. I'm glad you mentioned that, because if you look at, the baby boomers, 10,000 people are retiring every day. We're all at
There's a
some
lot of
point
us.
going to get borderline deal with diabetes. That's a common illness. So that would seem like an interesting market to go after, the senior market. I have an 89-year-old mother-in-law that lives alone, and she's got diabetes, and it would be good to do that. But again, how they consume the product would be different in that age group than the younger one,
Yes.
which I'm sure you thought.
Yes, and are they going to use smartphones? Does your 89-year-old mother-in-law use a smartphone?
You'd have to turn it into one of these
No,
things that hangs
no.
around the neck.
Yeah.
Does she
She's got
have
the
to
life
if
alert.
it's just,
Press one
does she
button.
have to if it's just there and she does her reading?
Exactly. You can set it up, and just as long as it stays charged,
Give them
she
the
could
iPhone
use
as
it.
charge, it does it,
Yeah.
boom.
So I'm sorry, so the 29 million people, what was that?
All day.
That is the total number of
All
people in the
diabetes.
United States with diabetes, both type 1 and type 2.
Okay.
And it's heading at epidemic levels, isn't it, for children too? Yeah.
Yes.
For everyone.
So that's who you want to go after. That's your market.
So if you were to go, so you said the need's not as acute, which I understand, which means, of course, you can't charge as much. Would it be acute enough for them to pay for the Bluetooth adapter and then half the price of the subscription? We all worry about our parents a lot,
Yeah.
and if it's enough to get them to fall over,
Yeah.
I'd pay money.
Sign up on ShugaTrack.com.
Yeah.
There you go. And Yeah, so it's definitely interesting. Two different markets. Obviously, I think the parent-child is going to be an expensive venture. You know, if you pursue the gamification, the community. You know, so something too that you may want to consider is really looking at a B2B model and say who might be a business partner to help underwrite
Yes,
your effort.
yes.
And I
Well,
think
that was the question you asked, right? Should we go after researchers, doctors, pharmaceutical companies, insurance companies? Have you talked to them? So we were talking earlier about the lean entrepreneurship model. Have you done the feedback cycle within the B2B community or only within the parent-child community?
It's been mostly within the parent-child community up until recently, and now we're beginning to talk to the clinicians and the people who can connect us to the people and companies involved in drug trials. So,
It just seems, you've now mentioned places that have a lot deeper pockets
yes.
and larger needs that might be a more
Yes.
attractive way to go.
Yes, yes, and we didn't do that initially because, as I mentioned in my background, you know, I'm not an expert in healthcare. I'm not an expert in the insurance industry. I'm not an expert in drug development, but I do have a wife with diabetes and I do have kids, right? And that's the market I understood, so that's where we went first.
So
Do
if
you-
so
oh,
if a
I'm
kid
sorry.
screws up and, you know, misses this, and there's some health implication, what do you think the cost is to mop up from that? I mean, if there's a hospital stay or something like that, how much could that cost relative to your preventative measure here? And
Right,
then
right.
turn around and sell it to an insurance company, say, hey,
Absolutely.
Early
50 bucks
intervention.
spent on me.
That was the 20,000?
Yeah, for hospitalization for diabetic ketoacidosis, if your
Yeah.
blood sugar is way too high, is $18,000 to $20,000.
So it seems like if you sold to them and then packaged up all this data you're collecting to them so they can market something else, some other plan on top of it.
Or let
that-
the insurance companies actually sell it to the consumer. You sell it to the insurance companies in two versions, one that they can sell to their insurees, and another, the cloud data, that they can analyze and figure out all their nasty formulas from.
Yeah.
The cloud data, you have to be careful, though. As a parent, I would not want you to share my child's information to a pharmaceutical company.
Would have to be
So-
aggregated.
Well, what if it's in the insurance plan?
If it's in the insurance plan?
It would be aggregated, though. It wouldn't be
Yeah, true,
individual.
True.
I mean, I'll take the opportunity to say we comply with HIPAA. And
HIPAA privacy, yeah.
And HIPAA, you're only violating HIPAA if you provide both identifying information along with the health data, right? And if we strip any identifying information from the blood sugar readings, right? So it's just a number. It's not a name. It's not a social security number. It's not an address. Then you're still in compliance with HIPAA, and you can provide those data to researchers, to other people.
One of the questions you asked was about going viral. And you've got the good emotional base that could help this go viral. What kind of stories are you hearing from customers that you're engaging with so far? Are we getting any, you know, my kid used to have incidents once a month and now there are none, you know?
Yeah. The word they use is godsend.
Oh, godsend is a nice thing.
I hope you're getting case studies.
You're writing these down.
Okay.
Yeah.
Good. Good, good, good.
So
So-
panelists, let me ask you at this point. Give John what you're excited about, where you see some real opportunity here, and then something that you think that you know he needs to address that might be a landmine, and then your parting thoughts. What he should walk out tonight and thinking about.
Yeah. You know, it's easy for me to sit here as a panelist and say if I were in your shoes, right? That's an easy job tonight. And I know what it's like being out there, trust me. So I see some great opportunity, and I don't know how you bifurcated. I noticed you have two brand identities to me. You have ShugaTrack and then
The company's name is Applivate.
Applivate.
Yeah, and the product is ShugaTrack.
Right. So it's interesting. I think, you know, number one, maybe think about what's your brand. I think ShugaTrack is very sexy. I love that as a company name. I think it says what your product is. But that may limit you if your portfolio is to grow that and expand, okay? So that's something to think about. If you decide that you want to go after the consumer market, it's expensive and something you got to sit there and do your numbers. but it's kind of like the Gillette razor blade scenario, right? You're in the internet now, you're in the cloud, you're with a generation that's going to continue to evolve in the internet, so you won't lose them long term. So do you give the product away and look towards making money on membership and advertising? Something to think about. Okay, and if you go to that market, I really highly recommend that you identify the personas of all the target audience, because the buyer's journey is going to be different for each of those children, those groups of children. So really, really target it down, and I think you're going to have different messaging for each group, right?
Yes.
And then the other scenario would be finding a business partner that can help underwrite this. And I would approach it from a wellness perspective, a preventative cost-saving measure. The insurance companies would love that. And see about how you can package it for, for them to use it. I'm almost thinking, Steve, is an OEM model, but that doesn't make sense here, but you know what I'm talking about? You're the original equipment manufacturer. Let them use their brand, co-brand with them, so you're leveraging their brand to get your product out the door.
Yeah.
So what I'm really excited about, I like the gamification idea that came up, but I'm concerned that the market's too small to really take you very far if you put a lot of effort into that. The emotional base that you've got with this, it pulls on people's heartstrings when they're in the middle of this. Diabetes is a serious problem. The landmine is, I think if you continue on the consumer path, you're going to run head-to-head into competition from the meter manufacturers who are just going to integrate Bluetooth and do they were already starting to do apps. So I really like the idea of going further into the B2B side, as has already been talked about. Insurance companies absolutely pay for things like this. The data, if not actually a tool, then there's a big effort. I know Blue Cross sends me stuff all the time. I have asthma. Here, we want you to try this thing because we want you to better control your asthma. Here, we want you to try this thing. And you could be one of those things for diabetics. So the researchers, doctors, pharma, and insurance companies, which you didn't have on your list, I think pose a bigger, more profitable opportunity in the long run.
And can I throw in Jocelyn Clinic?
Yeah.
Yeah, okay.
Yeah.
So I thought you were really onto something. I like the idea. I think your real value is going to come in the fact that you're collecting a ton of data, and you got to look at what are you going to do with that in the long term. To whom will this have value, and how will they make money off of it? And they're the ones who are going to multiply your effort. I do think, in looking at your solution, it's a little clunky. A kid carrying around this meter and this thing they got to plug in and a phone, that's a lot of stuff for a kid to go after. So it's probably not worth your while to go down trying to develop that slick solution, because there's established players there. So your value is the fact that you can collect data from a lot of different devices. And to take that to the next level, so if you get all those diabetes, the data collected on the performance there, couple that with a Fitbit, couple that with some other medical condition. Could you be the aggregator of more of that information? And then is there a compound thing you could learn by knowing from Fitbit, if someone's walking or running, you know what their insulin level was, you've got the data to say, are you going to have a problem based on some other trend that you're doing? So look at the second order processing you could apply to that just a glucose meter guy is not going to be able to do.
Ooh, the
That's
Samsung
your
phone,
differentiator.
it's also collecting data. You could be a collector of health data, and this would all be pure B2B.
I think your value is in the data, not in the mechanics of doing this operation, because other people are pointed at that and have been doing it probably longer than you.
You're not making money off the hardware anyway, right? So make money off the data.
And then figure out who then is going to make money knowing the data that you know, and then they're going to be the ones that you're going to go look money from.
And then you'll make your million.
You want more
Millions,
than that.
many millions.
Go on.